Think about the things that come to top of your mind, and we have it broken up into these 3 areas, right? So health equity, community engagement, systems change.
It's our intention to invest in communities that have been historically marginalized, that haven't had a traditional seat at the table, so that their opinions, their beliefs, their experience actually drives the conversations at the policy and advocacy level, drives what are the sort of practice solutions that are in place, and drives ultimately how are we improving oral health and how do we measure and track it over time. There are some key stakeholders who are really holding all of the power and sort of the discourse on what decisions and what policies and practices are in place to support the oral health of all. And we know by looking at data, we know by talking with our grantees and in relationship, is that the system is not working for everyone.
We look for a group of grantees and partners that are really looking to take the community that they're in and make change in the oral health world. We do that by really strong relationship management and advocating for every person that comes into our system. You know, we want to know why they feel the work they do is important, then we advocate for them.
Our no wrong door policy or approach even is really based on the idea that we want to partner and build a network to change oral health systems for the better. That means that even if an organization might not be the perfect grantee fit for our grant making, that we are going to do our best to connect them to other resources here at CareQuest Institute to make sure that they're positioned for success and that they ultimately can be empowered actors in our overall collective efforts to change the oral health system. They have historically not had an opportunity to inform the exact system that has oppressed them. In order to change the system permanently, but also successfully, we really need to be in discussion and communication with those populations, because if those populations are served and served well, then everyone will be served and served well.
And our tanks are filled by relationships, by advocacy, by equity, by doing all those things that we can do as an advocate for an organization to help create change.
Really critical to our work is creating that environment so that we can sort of troubleshoot, co-create, and co-develop solutions with our grantees versus for them.
The old adage is those closest to the problems are the closest to the solution. The philanthropy team really lives by that motto and that credo. And so that they seek out the voice, they seek out the co-creation of solutions, they seek out pathways for the systems change that we're all after through the lens and the eye and the lived journey and experience of those communities. They're intentional about it only because they know if those solutions that we are co-creating and we are identifying are to work, they need to be done with the communities having a meaningful and a vocal seat at the table.